only about half of the people diagnosed with oral cancer today will be alive in 5 years. And that's a sad fact, but a lot of it has to do with early detection. And early detection is not something with oral cancer that is done well a lot of the time. Part of that is because people aren't seeing the dentist regularly to have it checked out. Part of it is sometimes on dentists for not doing a thorough oral cancer screening, but a lot of us are trained more and more with this generation of dentists to do that. So finding oral cancer early, as with most types of cancer, is by far the biggest factor in treating it well and having a good survival rate and outcomes. So what can you do? You can see your dentist every 6 months. You can make sure and just ask them that they're doing an oral cancer screening and make sure everything's okay. You can check for yourself as well, different parts of your mouth. The most common spots to see oral cancer would be on your tongue, usually the sides or underneath. Sometimes the cheeks, sometimes inside the lips and the soft tissues. A little more rare on the gums themselves. But look for any odd white patches, red and white mixed patches, things that seem irregular in shape. Doesn't always have to be raised. Just any abnormality that you haven't seen before. Keep an eye on it, and next time you see your dentist, let them know. And if things change over time, let them know those changes. Some risk factors that can come into play with oral cancer. It's very similar to other cancers a lot of the time. Chronic alcohol consumption, smoking. Those are two of the biggest ones, which is part of the reason why oral cancer may have gone down a little bit recently. Both detection being better and our generation just is not drinking as chronically as past generations. But definitely using tobacco pouches or loose tobacco, so dip. The research isn't out there yet because they're so new with the new nicotine pouches, so we're not sure yet if those have an effect, but I would be surprised if they didn't have a little bit of a carcinogenic effect. But basically, just being aware of what you can do to detect cancer, what you can do to prevent it, and to stay away from some of the risk factors is really going to help out in the future. So see your dentist every 6 months, ask them if you're doing oral cancer screening, and just make sure you're staying up on it.